Hello, I'm Dr. Greg Winteregg, CEO of the Private Dentist Alliance. I want to talk to all of you students out there today who are wondering what your future is going to be like as a career in dentistry. As an assistant, as a hygienist, as a dentist, where is this profession going with the rapid increase of the DSO movement? I'm here to tell you that PDA is going to help you, and I want you to become a member today. It is free. Now, why should you become a member? You're going to get weekly video updates from me, and you're going to get regular updates of our newsletters from the Alliance on exactly what is happening and how we are going to help preserve and protect the private practice of dentistry. Now, to me, the most important advantage is you are going to get access to our job board. What is that? Our private practicing members all have access to our PDA job board, which means if they have an opening in their private practice of assistant, hygienist, doctor, front office staff, they're going to be able to post it. And you're going to be able to check up regularly. And as our membership grows, we're going to be covering larger and larger territories across the United States. If you are looking for a job in any position in the office of a private practice, you need to become a student member today. It is free. Go to www.privatedental.org and become a student member today. You're going to love your benefits. Do it now.
What is up, guys? It's your boy Matt Havis back at it again with the Dental Student Vibes podcast, and today we have a really cool interview for you. We have Dr. Sam Eldiry. He's a private practicing dentist in Melbourne, Australia, and he gives us a hot and fresh look on all of the new techniques in dentistry, how clinical dentistry is changing based off of the technology coming out, what he expects for clinical dentistry and his hypothesis for it in the years to come, and what we can expect as we come out of school. It was a really cool interview. He also balances the clinical portion with what you can do to be the best possible person, whether it's with your loved ones, your family, your friends, and how you can balance dentistry so that way you can really just be a quality whole person. And that is super important. We believe in that at the Dental Student Vibes podcast, and we want everyone to be the best possible version of themselves. So, as always, check us out on Instagram at dental.student.vibes. Make sure you give us a like, comment, review, and as always, stay safe and vibe on in these crazy times.
All right, welcome back to another episode of the Dental Student Vibes podcast. My name's Cole Herzig. I'm here as always with Anthony Wallach, and we have a very special guest joining us all the way from Perth, Australia, Dr. Sam Eldiry. Sam, how are you today?
Hello, how are you guys? I'm good, thank you so much, and thanks for having me today, for having some time off to join me, and yeah, I have the honor to be with you today.
Thank you so much for joining us. Anthony, how are you today?
I'm doing pretty good.
The day was hectic, actually. It was quite hectic. I usually wake up around 3 a.m. I go exercise in the morning and then I cook my meals, 5 meals, and then I start the day.
There you go.
You cook meals every day? You cook your meals every single day?
I cook
you don't
like
meal prep?
five solid meals every day, yeah.
That's good. That's how you stay in such good shape. We see, you're always working out on Instagram. That's awesome.
Yeah, thank you. Yeah. It's a lot of hard work and dedication, of course. But yeah, that's how it is. You build up slowly. That's with anything in life, like your health, your career. We all start as like inexperienced dentists, and then we build up slowly. And then if you have a plan, and then you just build your way up towards your plan, and then take it slowly, and then slow but sure. So that's life in general. Dentistry, health, sports, anything in any aspect of life. It's pretty much the same concept. So yeah.
That's awesome. Well, Sam, can you take us back? So I was reading your bio a little bit, and it was talking about, how you've been interested in dentistry since you were 13. Can you take us to, from that time you're 13 until, now, how did you go along that journey?
Yeah, well, okay. I had an awesome dentist when I was young, so I always looked him up, and then I said, like, I want to be like that awesome dentist. I want to be like a good dentist. And then he pretty much like inspired me to want to be a dentist. So, and since then I had to study hard because you have to score high, of course, to get yourself into dentistry back home, and then. So that was the plan. So back then you had no responsibility, nothing, just study and do whatever you do until you get there. And I used to be like a short distance runner, so I was doing sports all my life. So so I was keeping like active, studying most of the time, catching up with friends, and that's pretty much it until I joined I joined dental school, and then I started right away studying to get the license for Australia. And then I moved to Australia 2010, in June 2010. And yeah, I've been here since. I go back home, of course, every year just to visit. But thanks to COVID now, we're stuck here. We can't go anywhere.
That's awesome. And you said you're originally from Egypt.
Yeah, correct.
That's awesome. Yeah, we actually had a chance to speak to a dentist that he's doing his GPR residency in Cairo. And he was talking about how that hospital is amazing and how they see thousands of patients a day. And I think that's incredible.
Yeah, well, the good thing about Egypt is you get exposed to loads of patients. That's how you get experience, because we all graduate from dental school. We know very little. We don't know much, and then your journey starts when you graduate, actually. So yeah, it helps a lot to get exposed to a lot of patients. That's for sure. Yeah,
that's awesome. And where did you go to school for dentistry?
It was in Cairo. It was like
in Cairo. Awesome.
In Cairo, yeah. So it was like there's two big schools in Cairo, Cairo University and Ain Shams University. So these are the biggest schools in Egypt in dentistry and in medicine as well.
That's really neat.
So I graduated 2004. So I've been practicing dentistry now for 16 years now. I didn't think about that.
Time flies when you're having fun.
Yeah. Now, I'm enjoying, because what I do every year, I will start to develop myself, and then I focus on some aspects and start to developing those aspects, and not to stay still and do nothing, because nobody knows everything. So we all need to keep learning to evolve. Otherwise, you will not achieve much, because now digital dentistry as well is like very, very important. Like every single practice in the next 5 years, I would believe they should have digital scanners at least. And doesn't have to be like you have to have like a milling machine, but at least digital scanning, because with the digital scanner you can actually do mock-ups as well with digital scanners. So you can scan the teeth, send them to the lab, and then they would print up a 3D model of that scan without the need for impressions at all. And then they will do the mock-up as well of that print 3D model. So it makes life much easier. Scanning for like implants, everything now is using digital scanning. So digital scanning is a very, very big part of dentistry now that everyone should get involved in. That's my opinion.
I completely agree. I think the field is definitely trending towards that point where we're moving away from, taking impressions and more into digital stuff. And I think it's more efficient, and it'll allow you to have, better case acceptance, because it's more of a technological thing. It'll allow for maybe more case success, and you want your patients to be happy. You want to be an efficient dentist, and especially because you're so into implants, I'm sure that it just makes your job even easier. So I wanted to talk to you and transition into that point of it. So I guess we can call you like an implantologist, if you will. What made you get so involved in that?
I like 8 years ago, I saw like an opportunity in implant dentistry, and I thought, okay, this is the future for dentistry with implants, because a lot of people missing teeth. You will see like every single patients come to the practice, like I would say maybe 7 out of 10 they have missing teeth. So it's like and then you help them restore the function, not only aesthetics as well, because that fixes a lot of TMJ issues as well, and spacing and over eruptions and a lot of other issues. So that's why I started thinking of implants, because I know I want to help my patient. I want to give them the best service ever. And when I do something, I like doing it like professionally. I don't like just take some small courses and keep going. So I started with like a big surgical course in Colombia for 1 week. You go there and you do surgical implants on patients for the whole week, every single day. So you get very good exposure. You get like very good knowledge as well, and hands-on. And then I felt very confident when I went back to start placing implants. Of course, you get like a basic course as well, so that you understand what implants are, how to and when to place implant, and when it's too complicated for you as a GP not to place implants and to refer. So yeah, it was quite interesting actually. And that's how I started. And then from there, I started doing more courses, more programs, and I'm still learning, and will still keep going, of course. I get some courses every now and again in Botox injections as well, so that we can help patients with TMJ problems, some cosmetic courses as well, to be able to deliver the best crowns and veneers to patients, like full mouth rehabs and all of that stuff. So yeah, I'm trying to cover all aspects as much as I can, which is not easy. But as you see, I've been practicing for 16 years. So every year or a couple of years, I'll try to improve my skills in one aspect or two aspects, and I focus, and then I move to another aspect, and I keep going. So you reach to a point after 16 years, then you build up a lot of knowledge and a lot of skills as well. You get, because dentistry, the more you work, the quicker you are, the more efficient you are as well. And then you learn as well. And there's, I say, in my humble opinion, there is no right or wrong in dentistry. You might do the same, the same thing, but with a different plan. You'll have a different plan. You'll have a different perspective, and there is no right or wrong here. We might deliver at the end of the day the same result to the patient, but with different approach. So yeah.
No, and that's awesome. It's you really into cosmetics, and I love that. That was one of the first things that I saw on your Instagram page. You've got the camera set up, all the really nice equipment, and that's awesome. And it delivers that really nice, like Anthony was talking about, case acceptance, and just that really nice aesthetic feeling that your patient can feel super happy that you did this amazing smile makeover for them. And I think that's awesome.
Yeah, thank you so much. That's again, that's about almost 2 years ago, I decided that my photography skills are skills are really bad. It was very basic. So I said, okay, we have to do something about that. And then I approached the guy. He's in Romania. His name is Milos Miladinov. He's a very good guy with professional dental photography mainly. And he was coming to Melbourne in September last year. And then I joined his course for 2 days, and that's when this all started with the photography. So yeah, he's a very nice guy, very knowledgeable, and his course is very informative. So I've learned a lot from him. So as I said, I try every year to do something different to improve my skills and get something new. And as you said, case presentation is really important to get case acceptance as well. And the patient would feel like, because I have a photography studio at the practice, so, and with like external lights and diffusers, so the patient, they feel they are in good hands just the moment they walk in, because they are doing your best. You're trying to be as professional as possible and to deliver those shots as well. You take to the lab to communicate with the lab properly, which is only a very helpful tool.
That's awesome. No, that's super cool. I think it's really neat that you've taken that to the next level, and that you said now you're doing almost your 4th implant course and 4th master's in that. So going back to what you talked about in Colombia, other than Colombia, what other programs have you done and what you would recommend to any, GP that wants to get out there and, learn a little bit more?
Yeah, okay. I would suggest to start in the States. Of course, if someone is really interested and they want to focus only in the implants, you have a great program in Loma Linda University. But that's the problem with that program. It's a full 3 years implant program. So you become specialist, but I believe it's quite expensive. And but if you have the ability, for example, to join that program, that would be the number one choice. Other than that, if you want, you can start with just a basic course for 2 days and then go to I believe MIS are still providing that course in Colombia to do those surgical implants, because what you do there, you place around 22 implants with 2 open sinus lifts, like lateral window, and then you observe another 30 or 40 implants as well with your colleagues while you're assisting them. So you get exposed to over 50 implants, all in total. But yeah, it's quite tough. You start 8 a.m., you finish 8 p.m. every day, but it's worth it, to be honest. So you feel, if you want to start placing implants, or anyone wants to start placing implants, that would be the way to go, just to feel comfortable placing implants, because they make you place implants in different aesthetic area, like aesthetics in the aesthetic zone area, lower and mandible, and you have a feel of the mandible while you're drilling in the hard bone, and then you go to the soft bone, and then you go to the front area, how to angle your hand. Of course, nowadays, the fully guided surgery makes life much easier. In the past, I used to do with just the normal surgical guide, and then you need to get the radiographic guide as well. But nowadays, the way to go would be fully surgically guided, and try as much as you can. No healing abutments, just a temporary crown right away on the top of the implant, providing that you get a primary stability to get the best shape of the tissue healing around the implant crown. That's the new protocol in Germany now, and in the States as well. But yeah, as I said, as a start, this would be a very good start for anyone who's interested in implants. And if there is someone who has a reasonable implant knowledge, they can join the 1-year master program in the States, which is the guide one. It's a GIDE with Loma Linda University. That is a very, very good course, perfect. You get it's called Master's Clinician in Oral Implantology. You learn pretty much everything about implants and all-in-4 and everything related, and soft tissue management, everything. So if you are still a newbie, or if you're still just starting your implants journey, this is not the way to go. But we had a lot of newbies as well, but it was very overwhelming by session number 2, 3, and 4, because it's very, very advanced. So my recommendation is, if you don't have enough knowledge about implants, to start with something like Colombia, and then you move on after that. You can improve if you want. You can join progressive courses. It's a journey. It's a learning curve. You like it or not, it's going to take some time. But at least you need to be on the... are you guys all dental students, or you graduated already?
Yeah, we're
all...
Mm-hmm. Yeah, Anthony's a 3rd-year student, and I'm a 2nd-year student.
Okay. So you're just starting your journey. So you still have 2 or 3 years to go, right?
We do a 4-year program here, and then the residency is optional here in the States.
Okay. Do they start teaching you guys some implants at uni, or not yet?
Yeah, so we started learning it basically, through classroom stuff 2nd year, through lectures and stuff like that. No hands-on stuff. And now we've been working on these certain typodonts to place implants. We've done that a few times in the 3rd year. and
Good.
then we are able to restore implants, but we are not able to place them.
Perfect.
So we're getting exposed. It's not like we feel like we're in the dark here, which is nice. But I completely agree with what you've been saying. And to all our viewers, Dr. Sam here has a very good mantra of just, taking it, like you said, it's a learning curve. It's a marathon, not a sprint. And whether it's just with the implants or even just with learning class twos, guys, you got to take steps to this stuff. You got to build the foundation. And then when you're in the game, 20 years or so, everything will get better. So I don't feel like I have a ton of knowledge on implants. I feel like I know the basics. I feel like I personally am not bad at it, but there's so much more that there is out there. There's more than I probably even know that's out there right now.
Yeah, we are all still learning. There is no one, I'm sure, knows everything about anything. No way. Even our lecturers, they are still learning. Everyone's still learning. There's nobody just reached the ultimate knowledge point. This is not going to happen. So there's always more, and it just depends on your like. I would say the sky is the limit, if you want to put it that way. But it depends on your interest. Everyone have their own different interests. You might be interested in implants. Other guy might be interested in just root canal treatments, for example. Others would be interested in surgeries, perio. So yeah, it's different interests. You need to, and you might not even know what you want to do until you start practicing dentistry in real life, in the practice, which is not. It's nothing wrong about it, because when I first started, I said, okay, I want to try braces. And then when I started working as GP, and then I said, I don't think I would be really interested in this. For me, it's a little bit boring. It's like you are married to the patient for 1 or 2+ years. And then, yeah, it's a big responsibility. And then it's a very slow process. And yeah, I wasn't really interested. So nowadays, we're doing more Invisalign because it's much quicker, much easier. Patients love it. But for me, I'm just doing the simple cases. I don't do complex cases from second premolar, for example. But again, that wasn't an option back then. And then as you go, you start finding or discovering new interests in dentistry. I didn't know when I graduated, I want to do implants. I didn't know. You have to start first, and then you see what you like and what you don't like, what you're interested in. Because if you start doing root canals, for example, you might hate it. You wouldn't like it. It's not your thing. So you can't really decide now. It's a little bit early. Unless you have a special interest in something like surgery or something like that, then that's pretty obvious or clear. You want to get involved in surgeries, for example. So yeah, that's my opinion though.
That's awesome. And then reading your bio from Keys Dental, so it says you do a lot of wisdom teeth extractions. So did you take any expanded courses beyond school for those, or was that just something you really decided you had a passion for?
For wisdom teeth extraction in particular, what happened, because we were exposed to a lot of patients back home. And then when I came here, I had a great mentor at one of the private practices. He showed me how to do the flaps and all of that stuff, and how to drill bone around the wisdom teeth. And that's I started, and it was a very, very slow learning curve. But the more I got into extractions, the better I became, and then the quicker I am. And then suturing techniques, all the implant courses I had, that helped me a lot with suturing as well. And my sutures, improving my suturing skills, and the dexterity of the hands as well. It's different now from 8 years ago. So as I said, it's again, it's different from one person to another. You might be a very quick learner. You might quick like this. For me, I'm a bit of a slow learner. So I need some time to get there. It takes me some time, but I am very consistent. So that's what makes it easier for me. That's because I'm consistent. So I don't care, even if it's going to be a little bit slower, but I don't care. It's working for me this way, and everyone is different. You might be a quicker learner, so you don't have to wait all that time to be good at something. So yeah.
That's awesome. And then can you touch a little bit about, so, we read your bio a little bit and then we talked about you. So you work at Keys Dental. Can you talk about, so is that a private practice system or is it something that's owned by, the
It is.
Australian government?
No, it is a private practice, yes. We have 6 surgery rooms. I do a lot of IV sedations as well with patients because we get a lot of anxious patients. And especially with straightforward implants, I don't do IV sedation. There's no need because it takes about maybe half an hour or something and you're finished. But for complex cases, if you need like a soft tissue grafting, if you're going to graft from the palate, for example, and get some bone from the patient and graft it and build up some bone and soft tissue, that's a bit traumatizing to the patient. They feel nothing, of course, because they are numb, but it's a lengthy process and they feel uncomfortable. So we put them into sleep, like IV sedation. It's actually a very, very helpful. So yeah, we have like 4 dentists. We have 3 dental hygienists as well. So we have a very good, powerful team when it comes to hygiene as well, which is really important in dentistry because soft tissue is the foundation. And if you keep the soft tissue healthy, you have a healthy bone and healthy teeth as well, and healthy mouth, healthy, like the whole body system would be healthy because, you can get like heart disease from the gum and the whole body is connected like a map. So if you keep that area clean at least and healthy, then you are at least like doing your best to be healthy in regards to that area. So yeah, so hygiene team is really important as well. Yeah, we are pretty much doing everything in house. Just the only time when we refer is when we have like a complex orthodontic cases or very complicated or complex surgical extraction that's with the roots are like maybe wrapped around the nerve and then it might need still I can get it out, but when there is an increased risk of nerve damage or injury, then I'd rather refer to a surgeon or a maxillofacial surgeon to do it. So yeah, we pretty much try to do everything in house.
That's very impressive. Do you guys all kind of have your own specializations, all the dentists there, or are you all considered cosmetic dentists and then you take similar courses?
We have one dentist who's like a prosthodontist.
Mm-hmm.
He is 10 years older than me, and then we have another dentist who is an orthodontist as well, but he's doing basically like simple cases as well, not very complex cases, because he doesn't want to get like into like complex cases so much. That's why we refer some cases outside. And another dentist that's just a new grad one, like 2 years ago, graduated 2 years ago, and and the hygiene team. So yeah, that's pretty much it. But yeah, I'm doing most of the surgeries at the practice. So we get like just internal referrals, like in-house referrals for surgeries when it comes to this. And yeah, I would say, yeah, the cosmetic cases as well, the veneers and the full mouth rehabs as well.
That's very nice because that keeps your volume up for all you guys working together. Do you have any business advice for us? Because it seems like you have a very good business plan set up here for your practice.
Well, business plan is like, to have a business plan, you need few factors. Okay, the first factor is your team. You need like a solid, strong team and healthy environment. That's the first thing. And you need a good leader as a practice manager. And then you need good dentists with commitment to have a solid plan for the future. Now, if you try to like plan ahead 5 years or something, all what you can do, because you cannot predict the amount of patients you see every day or every month or whatever, but all what you can do is to work towards it by creating a positive energy vibe in the practice, having a good team, having good dentists and communication, between all the staff members, and then it's going to happen. The progress is going to happen. The improvement, the growth is going to happen. No matter what, it might take time, but you get referrals, you get word of mouth as well. And yeah, if you do good dentistry, you will get more referrals, and you will get you will grow. The volume will grow as well, as you said. But you cannot. You have no control on that. The only control you have is you do your best, try to tick all the boxes, and then it will come eventually.
That's awesome.
I think that's excellent advice. Yeah.
No, I think that's phenomenal. And then going back, you said before, we talked about, all these different things that you take to, elevate your game. You talked about some IV sedation. So did you do the IV sedation with the surgical courses, or did you take a separate certification, a couple courses for those?
I don't do the IV sedation myself. Otherwise, it's going to be I have to study 2 years full time for that. So we use an anesthetist, a sedationist, to do it for us. So he comes in with all his equipment, oximeter and everything, and all his resuscitation equipment. And then we do but we have to plan ahead, of course, like a month ahead or something.
Oh, that's awesome.
So
Okay. Go ahead, Anthony.
So you guys will have just like a day where you have a bunch of patients that need IV sedation, and you just kind of like have that day marked out in the month pretty much. It's not like he comes in a few times a week.
Yeah, we set up, like we do it once a month, for example, now. But we can do more if we want. But because the anesthetist I'm using is quite busy as well, so sometimes it's really hard to do twice a month or 3 times a month. So we prepare 2 rooms, one for the surgery and one for recovery, for example. And then once we finish that patient, we move that patient to the recovery room, and we have the other one sitting there. By the time we finish with that one, the other one in the recovery is done. So we move that to the recovery, and the next one is in. You see how it works? Yeah, that's how it works. So yeah, we try to keep it smooth as much as possible.
That's awesome. I love that. And then, so, we touched on surgery, we touched on IV sedation. So with the cosmetics, obviously you do beautiful work, and it's very natural. And I love that because, you see a lot of smile makeovers that it's overly white, or the consistency is not the same, or you don't see the blending of the shades from the cervical to incisal thirds.
Correct.
So, where did you, get some of that? Because in school, of course, you're not going to get all of that great experience doing cosmetic work. So where did you get, some of that great knowledge that you have?
You get like, as you go, like with all the courses I had in implants as well, that was, some of them included some cosmetic work and makeovers, smile makeovers as well. So, and as you go, you learn from other dentists as well. And you hear from this and you hear from that guy, and you watch this guy, and then you learn one tip from here and a trick from that one, and then you build up the knowledge. The other option would be doing a master's degree in aesthetics as well. That would be an option, but I built it up like slowly, like through the years. So I had some courses here and there, and like it's an accumulative knowledge. It doesn't happen overnight. It takes time, and then sometimes you start, and then what did I do wrong? Next time I'll do something different, and then it's a learning curve again, and sometimes it's a hit and miss, and until you have the consistency, and then you know what you're doing, and then now there is like a formula I'm using, and then it works, and then if it works, then I'm not going to change it, because I tried a lot of other formulas and they are not working, or they're causing trouble to the patient. The temporaries keep coming off. Now you reach to a stage, I know what I'm going to do, how am I going to do it, and then that's it. The veneers, the temporary veneers, for example, you use like shrink-in technique, for example, to leave them in. Otherwise, they will keep coming off. So yeah, but you try a lot of other techniques, and then you see at the end of the day what works for you, especially when it comes to cosmetics as well, because there are heaps of different techniques there as well when it comes to cosmetics. But it was accumulative. It wasn't like just a simple course I had and then it gave me all the information I want.
Right. No, that's good to hear, because a lot of people just think, sometimes you can take one course and it's a catch-all and you're ready to go, the next day. But it's good to actually hear the truth behind that it takes many years, hard work, grabbing from different sources. And I think that's honestly the best way to approach anything. If you just take one person's word as gospel and then you go and practice it, maybe it's not, like you said, what works for you. You can kind of grasp different ideas from different people and then put it all together with something that really works for you. And you can create that beautiful product. And clearly it shows. So I think that's awesome.
There are definitely certain courses you will get what you want from, like cosmetic courses, of course. There are heaps out there. And then there are courses for anatomical build-up, for composite as well, because not a lot of people can do veneers because they are expensive. So if you want to to go to the next level, you can do beautiful work with composite veneers that looks absolutely amazing, and they would look pretty much the same like porcelain. The only difference would be just this is porcelain and this is composite, this is much stronger than this, and this might stain, this might not. But you can get delivered the same aesthetics if you have those courses, and these are like very good courses. There are a couple of guys doing amazing anatomical build-up courses, and if you want to just stand out and do something different, you don't want to just do like normal dentistry, there is a lot to do.
Right, that's awesome. So what does the future hold for you? We talked about things that you've done now. What does the future hold for you as far as dentistry, life in general?
Well, I'm focusing at the moment on like my career, as you can see, like trying to improve more and more, and then trying to learn more, finishing my master's degree in implants from Germany, trying to reach my fitness levels to where I've never reached before, which is the main focus at the moment, together with dentistry. I believe sports is really important. It has to be part of your life, because I see a lot of dentists, unfortunately, unhealthy, having back problems, having neck problems, and this is something you don't take lightly. And you would understand, because you are working out, so you feel good as well. You feel a good energy after that. You feel that your hormones, like the endorphins and all of those beautiful hormones that give you the feeling of feeling happy and positive, and that helps a lot. Not only that, you feel healthy and you feel like you have a good posture. You have your good muscles that would help you not to get injured, not to have disc problems, not to have vertebrae problem, neck problems. So I had like a dentist, a mentor. He was like the head of dentistry at the University of Western Australia. Last year, he had to go through like hip replacement and knee replacement, because he'd never practiced a sports all his life. And he said, if I'm going to give you one single advice, is to keep active. So that was his words. So unfortunately, we think that we have to focus on dentistry only. But in my humble opinion, there are other aspects you need to look after yourself as well. Before to be a good dentist, you need to have other factors all together. It's not a single equation. It's puzzles, and you have to put things together to come up with the perfect formula. There is no such perfect formula, of course, but you try your best. So, and of course, you don't have to be like into bodybuilding or like weightlifting. You can do any kind of sports, or just try to keep active, running, walking, even whatever, anything that would help you just keep the circulation going, and create a lifestyle, and try to find a hobby as well, which would help you out of dentistry, because being a dentist can be very stressful sometimes. Not for me now, because it's been 16 years already, so I don't get stressed now. Of course, some days they are like big days, and you have like a lot of complex cases, and you need to focus, and you get a little bit nervous. But generally speaking, 80% or 90% of the time, it's like a routine for me now. And but I enjoy doing other stuff, because if I'm doing dentistry only, it's going to be very boring. And I find it's like very unhealthy to just focus on dentistry. Yes, you might gain more knowledge than what I have, because you would spend more time focusing on dentistry. But I'll give you an example. 2 days ago, just 2 days ago, I had a friend who's not practicing any sports, and he's working very hard. He's a great dentist. I'm sure he knows much more than I do. And because he studies most of the time, and he's spending most of his time in front of the computer. Like 2 days ago, he had all of the sudden, his half of his face, he couldn't open his eye. He couldn't move his the corner of the mouth. And then they called the ambulance. They thought it's a stroke. They rushed him to the hospital. They did some CT scans and MRIs, and then turns out to be stress and facial Bell's palsy, and then could have been a stroke because of the stress, and the stress levels are very high. He's not practicing any sports. So that was very alarming to me. Like, it was like, I'm active already, so I have no issue with that. But I said, well, other dentists need to really learn from this. This is very serious, because he's a great dentist. Yes, he is a great dentist. Does he know much? Yes, he does not. He knows much, but I'd rather compromise some knowledge and to have a decent amount of knowledge at the same time to be healthy as well, to be honest. So, which is very important to me. I don't want to be the best dentist in the world. It's not a race. You need to be a good dentist, but you don't have to this guy is doing this, I have to do this, and I have to. Yes, you can improve, and it's good that to have that spirit to improve and to step up, but you don't have to be the best dentist in the world, because if you want to be the best, you have to study very hard. You have to keep all your time, most of the time, studying and improving and all of that. And you might not at the end of the day. It's it's a risk. And again, that's only a recommendation. That's my experience in life in the past 38 years. I'm 38 years old now. So I've seen a lot, of course, not everything yet. But yeah, when it comes to dentistry, I think I've seen a lot already. So yeah.
Well, first of all, best wishes to your friend out there who that's absolutely a crazy story.
Yeah.
But over here at Dental Student Vibes, we do preach fitness pretty much like it's a part of your dental school education, because we do believe that everything's so connected, and it's systemically, you need to make sure that you're getting that stress reliever and you're strengthening those muscles, because you do need, the proper ergonomics. A bunch of us here have played sports in the past. Cole and I are into weightlifting, in terms of powerlifting and hypertrophy muscle building and all that stuff. So it's always good to hear someone who's succeeding out in the field doing these types of things that we're already trying to incorporate into our day-to-day, lifestyle. And to see that it's working really feels, I think it makes us feel like we're kind of on the right track. But I wanted to ask you more about kind of like your day-to-day, do you meditate? What are some of those things that you do besides fitness? What are the things you're trying to incorporate over the next, 5 years or so that will help you not only stay healthy, but prevent you from maybe getting an injury that could, impact your career?
Fitness first, as you said, is the foundation. And then you need a good posture. You need maybe a saddle chair. You need dental loops as well. Loops are very important. They work all together. There is no single way to do it right. So it's always a combination of things. It's not a single thing or a single factor that would prevent, for example, the injury. So you have to work all that together. Fitness, good posture. Don't overload yourself. If you feel that's too much, 5 days, do 4 days. For example, some dentists doing 4 days only, 3 days and a half. They don't feel like they can't do 5 days. For me, it's not a big deal because I don't feel the pain in my back, which is good. I get some deep tissue massage every week or two as well. That helps releasing the muscles and relaxing the muscles. So yeah, well, yeah, that's pretty much like, of course, like out of that, like you have to keep like good social life as well with the family and friends. Don't forget about that one, because you need the balance. You need people, even if you don't feel like catching up with people. But at the end of the day, we are all human beings, and we need support from every now and again, like, or every now and then. We need the support from the family and the friends, and we need to feel loved. We need to help people. We need people to help us at some stage, even if you are self-sufficient, even if you are so independent. I don't need people in my life, but at some stage we all need people in our life. So you need to keep that a balance as well, like with social life. So it's a little bit, you maybe, if you try to connect all the dots together, you think, oh, that's too much. How am I going to do all of that together, like fitness, dentistry, studying to be a good dentist, learning, keeping like social life properly, and all that balance. Well, it's not easy. It's like, it's gonna take some time. It's gonna take some time, and at the beginning you'll feel that you are lost. To be honest, especially in the first few years, like first year, first 2 years, and then things will kick in smoothly, and then you'll start learning how to cope with the things differently. There is no formula that I can give you that would work for you, because every single one have their own circumstances, different approach to reach their target. So again, there's no right or wrong here. I'm just recommending, or just giving you an advice regarding the main points that you might need to consider, looking into them, and just making sure you're ticking all the boxes if you can, whenever you can. Sometimes it's good to be organized. At least have a plan in your head, put it down in writing, a flow chart that would help a lot as well. You put just some points like they're just brainstorming with your friends as well. Why not just have like study clubs every now and again, together, just to discuss cases, discuss how you can improve, how to be a better human being, not only a dentist, generally speaking. Yeah, so yeah, like even if you are 3, 4, 5 friends, do something like that every month, like sit together for an hour, brainstorm. Okay, maybe you come up with an awesome idea. Maybe your friend will come up with a brilliant idea. And then, oh yeah, why not? I want to try this. So just brainstorming is really important as well. So this is like, yeah, you don't have to, but why not if you can?
Right. And then Dr. Sam, that's awesome. So some final thoughts to our listeners. What's some advice that you can give to a student that's getting ready to graduate, or a first year, practitioner that's just right out of school? What's some advice that you can give to them? Because like you said, it can be overwhelming, and they can feel a little lost.
My advice is to find yourself a very good mentor. And yeah, like a good practice with a good mentor, because that's, it's either you would love dentistry or you will hate dentistry. All right, if your kickstart is awful, you will hate dentistry. So you want to love dentistry. To love dentistry, you need someone to guide you through. You need a good mentor. You need someone who's patient to walk you through the journey. It's a journey. So you need someone to show you the path, the right way. And then it's at the end of the day, it's your journey. But you need someone to guide you through until you find your own path. So it's going to be, as I said, a learning curve. It's going to be ups and downs. It's not only ups and downs in dentistry, it's ups and downs in your life. Just stay positive as much as you can, because you will see a lot and you will go through a lot. The more flexible you are, the more successful you become. The more negative you are, well, I'm not going to say you will go down, but it's going to make your life much harder, and it's going to make whoever lives with you, your partner, your girlfriend, your family, is going to make their life harder. And like they wouldn't like to stick around, and they like, yeah, so you have to start to maybe take some personal developing courses as well. Why not? Like how to like deal with different personalities, for example. That would help you in not only in dentistry but in your life as well, in your social life, in your relationship. Yeah, so I don't want to overwhelm you with all those information, because that comes with time. And then these are just main like lines, just like wide lines or main points that you can consider, because for you, your priority is different than my priorities. Your priority might be like, you have a beautiful girlfriend, you want to get married to her, for example, and you want to, and you have, for example, you have some issues together, communication issues, so you have to work on that first. That's what it matters. That's the most important now, becomes, because that becomes priority. So you set priorities first before you step one step forward. You have to set your priorities. Your priorities, 100%. You, if you have 10% in the same room, I'm sure, and you ask them to prioritize their life, every single one would prioritize something different. And even if they prioritize 5 things, every single person would prioritize 5 different things. So there's no right or wrong. Again, you have to have your own priorities first, and then you take it from there.
That's awesome. And thank you so much for that advice. And thank you so much again for talking to us. As a closing thought here, can you give our listeners some ways that they can get a hold of you if they want to check out your Instagram, or they want to ask you any kind of questions?
Of course, and I'm available anytime. Who wants to reach out, I'm more than happy to give any advice regarding any aspects of dentistry, of life, fitness, anything. I've read a lot into nutrition as well, and I know how to transform bodies. I've helped a lot of friends transforming their bodies as well. So any advice is welcome regarding a dentistry, photography, dental photography, fitness, whatever. So I'm happy to help. Yeah, anyone who wants to reach out, just add me on Instagram and reach out, and then I'm more than happy to answer whenever I have no patience, or as soon as I can, I will get back to you, or whoever asks anything.
Awesome. Yeah, and we'll post in the notes all your social media handles so they can check you out. And Dr. Sam, thank you so much again for talking to us, and this has been phenomenal.
It was my pleasure. Thank you so much for having me today.
Of course, it was a pleasure. It was great to talk to you, and great to talk to someone who's so like-minded like us, just, farther in their path than we are. So we're looking forward to going down that journey. So thank you, Dr. Sam.
Thank you so much. I will wish you best of luck, guys, and I'm sure you will do great in life. You seem to be very smart guys, and I'm sure you will do great.
We appreciate that. Thank you.
Thank you. Have a great rest of your day, all right?
Thank you so much. You have a great day too.
All right, take care. Bye now.
Thank you. Bye-bye.
All right, guys, that'll do it for our interview with Dr. Sam Eldiry from Melbourne, Australia. He's killing the game. We hope that someday we can be just like him in terms of the level of fitness he's at, plus his clinical expertise in dentistry. Truly an inspirational guy. We hope to have him on again soon. If you have any questions, comments, concerns, you could shoot us an email. You could send anything on our DMs through Facebook, on Instagram, whatever you guys want to do. We're here to help. Let us know if there's somebody in particular you want us to interview, or any knowledge that you guys want to know. We'll find somebody for it. So, as always, stay safe and vibe on.